Hello. Um, Wanted to make a quick video. I haven't done one in a couple weeks. It's January 1st. Happy New Year. And let's see what I've had going on with my dental work. First and foremost, last week I had a veneer just to pop off. You can see where the tooth was ground, filed down for the veneer to go over it. Luckily, I felt it getting loose, so I have the veneer, but the dentist office was closed last week because of the holidays, of course, and I've kind of had to just go without. But I'm going tomorrow morning and get that cemented on again. It should have been permanent, but for some reason it came undone. That's two that I've had to pop off like that, which is a little frustrating. What really scares me is if one were to pop off while I was eating and I didn't notice it and I swallowed it or whatever. That would be a problem. But both times I've been able to feel it getting loose, or not really. I can't tell it's loose, but I can tell something was going on. Another thing going on with not having any but one tooth on the bottom on this side. Doubt you can see that, but I only have one, and then a healing collar where my implant is in the hole that's there. I can't chew on that side. So as a result, I'm chewing everything on this side, and where she placed that implant is, if I'm not careful, that thing, sorry about that, if I'm not careful, that has a tendency to get really, really sore. I mean, I guess it's where the implant is still healing or fusing to the bone graft material and to the bone itself. Because I know she said that took, I think, 4 months to heal. But, yeah, that's a problem. So I've been doing a lot of ibuprofen, especially if I know I'm going to be eating in a couple hours or something. I'll get ibuprofen on board and try to get ahead of everything. Usually by the end of the day, it's pretty sore and I can't really eat much of anything. Last night I had chicken noodle soup. Today I've had, softer foods and took my time, and it's a little sore, but not like it could be. So don't know how long that's going to last, but with only being able to chew on this side, that side is going to get a lot of pressure from chewing. So been dealing with that. Aside from that, everything's fine. Everything's been going okay. I'm just, this has been going on since August, and it's now January. And I know that I still have 3 implants to be placed with 4 months healing time on those. So, it's starting to look like I'm going to be dealing with all this until maybe May of 2019. Started August of 2018. And I know that it takes time to heal and everything has to be done in steps. I understand that. And it's all going to be worth it in the end. But it's still, there are days that it kind of plays with your mind a little bit. But I'm upbeat. I'm thankful. I'm blessed. I'm lucky that I'm able to even get this done compared to back when I started, where all I had was a partial and my jacked up teeth on the bottom. So I'm not complaining. It's just, it's a patience game. Excuse me. It's a patience game, and I don't mean patience like a dentist patient. I mean patience like you've got to have patience when you're going through all this. There's time involved in healing before the dentist can make the next step. It's all part of the procedures. So, it may take me nearly a year to get all this finished, but I'm having a lot of work done, and everybody's situation is different. Everybody's getting different procedures and different amounts of implants and bridge work and veneers and crowns. The whole thing just it's um, it's really individually specific. So I'm not complaining. Just venting, I think, is the word. But anyway, all is still well. I'm not losing faith. I've got a great dentist, Dr. Patel at VSP Dental in Danville, Virginia. I'll put the link down on the bottom so that if you want to visit her site, or if you're anywhere in the area, near the area where she is, I'd recommend giving her a shot. I like her, and I've never trusted dentists all that much, obviously, by the lack of care I've gotten over the years. But yeah, her and her staff both have really come through. They've changed my mind about a lot of things. So just to end up, Happy New Year, and looking forward to a good 2019. Everybody take care.